The reason that I sought certification to certify that someone was legally allowed to have medical marijuana was that I had the requests of several of my patients with significant medical issues, including cancer, chronic illness. And at that point, because I really wanted to be an integral part of their care, I felt it was important that I sought that certification so that I could, collaborate with everybody involved, whether it be their oncologists or the pharmacists or whomever was involved in their care. Part of that process is certifying that a patient has one of 17 criteria, and one of those 17 criteria allow us to complete the remainder of the application.
In June of 2017, I was diagnosed with multiple myeloma, which is blood cancer. During that time, I experienced a lot of the side effects of the chemo. I wasn't feeling really good to begin with, and then the chemo on top of it, just a lot of nausea, fatigue, dizziness, anxiety at times where it's like just coming out of nowhere, poor appetite. Some of the prescription medicine that I was given for the side effects of the chemo, which a lot of people get relief from, I was not. For example, one of the medicines for the nausea, it gave me heart palpitations, and I felt horrible, and it didn't do anything, it didn't help with the nausea. So I started to investigate some other treatments, essential oils or peppermint or different kind of teas. And then someone had told me about CBD oil. It kind of helped with the anxiety and a little bit with the appetite. I was on more chemo. I was feeling worse and worse. And so the remedies that were kind of helping some, but not completely. So I was pretty anxious to find out about when the medical marijuana was going to be available for me. Finally, in December, Dr. Burick said, go online to register.
The patient goes online through pennsylvania.gov, completes the application process, and then once they've completed the application process, then a physician who is legally able to certify does the next step. And so that's what we do for our patients that we deem appropriate and meet the criteria.
I received my medical marijuana card and went to the dispensary and met with the pharmacist and told him what my symptoms are, and then they recommended products for me.
Once a patient has a recommendation from a physician and has registered, they will get a medical marijuana card in the mail, similar to a driver's license. And with that card, they are now able to gain access to our dispensary. So what we do then is we actually sit down with the patient, we talk about their past medical history, the other meds that they're currently using, their history with cannabis use. So we spend, every patient's different. I would say at least 15 minutes, probably as much as a half hour, maybe even longer, with the patient, explaining how to use the product, which products make sense. The patient's in the driver's seat for the most part. We're there just to make recommendations and just to make sure that the patient doesn't get something that's going to harm them, because there is some pretty high potency medications, and we just want to make sure that what they're getting is going to help them, not hurt them.
After my meeting with the pharmacist, where we kind of collaborated together based on my symptoms, what would be the best products for me to use at this time, I was given 3 different strengths in an oil form that is used with a vape pen. And then I was also given a really concentrated form of oil called Rick Simpson oil. Dr. Burick and Eric, the pharmacist at Organic Remedies, have been very attentive with follow-up phone calls asking me, how is this working for you? And because it's really new, we're learning together. And so I do feel very comfortable because of that support.
It's not traditional pharmacy. I was a pharmacist for 27 years where, a prescription's written by a doctor. We would get the prescription at the pharmacy, and it would read something like, a 50 milligram tablet, take one a day, give them 30 with 5 refills. With cannabis, it's not so much, and you're not getting a prescription, you're getting a recommendation that this product may benefit this patient. So it's really working with the patient to choose the right type of product, meaning is it a tablet, is it an oral spray, is it maybe a topical that you rub on an area. So everything from the type of product to the strength of the product to how often they're going to use it, and that all varies greatly on the patient.
The biggest benefit that I liked to see with some of those patients is not only their main suffering relief, but also the ability for me to see that I could reduce other prescription medications, opioids, anxiolytics, medications that otherwise are habituating and very sedating and have their own side effect profile. There's so many complications associated with these scheduled drugs that if we could use something to enhance the benefit of the treatment and lower the amount that they really need, we're going to have a better overall benefit for the patient.
Right now, it's pretty much an all pro experience. Yeah, I am definitely sleeping better. My appetite is better. I am extremely thankful for Dr. Burick's involvement and Eric, the pharmacist's involvement on my journey with multiple myeloma and how the medical marijuana is going to help me through some of the harder symptoms that I'm going to experience as I continue with the chemo and the treatments. So I'm very thankful for the relationships that I have with them.
We need to look at the patient as a whole person, and my mission is to help people understand how this process can help people with some of these chronic underlying medical issues that qualify them for this therapy. But it's to help them understand that this is not the sole and only thing that they should be doing, and they should certainly involve those who are going to be able to help them make some of those changes in their lifestyle, whether it be a therapist or somebody who could help them with their nutrition or something to help them through this process, to really understand that it is not cut and dry. It is a process in which people need to learn to manipulate the different variables in their life to come up with the best treatment plan for them.